Good sleep is so important for good health, and problems related to sleep are very common presentation in primary care. Disorders affecting breathing and sleep are varied, but they can impact multiple body systems. The majority of people with sleep disordered breathing actually remain undiagnosed. So when they come to their doctor, it's actually undiagnosed. In this video, we're going to talk about some of the causes and why sleep disordered breathing occurs, and how we can identify people with sleep disordered breathing and how these are then managed with some useful tips and tricks. Welcome to the channel where we discuss medical topics and lifestyle. So, what is sleep disordered breathing and why does it happen? That's the first thing we're going to get into here. So, picture a man. Let's say this man is 60 years old, and let's say that he feels tired all the time during the day. He has poor concentration. He still goes to work and he finds that he is dozing off or falling asleep during meetings that he's taking. He drinks a lot of coffee, 5 or 6 cups a day. He doesn't have any problems falling asleep though, so he sleeps through the night just fine. He sleeps fine, he doesn't wake up, it's not broken sleep or anything like that. But for some reason, he wakes up with a headache and he needs a lot of snooze and alarm clocks going off. He's not obese by any means, but he's gained maybe a little bit of weight recently. He's not a smoker, but he has the odd glass of wine with dinner. His blood pressure is stable, and his wife is worried about some strange breathing at night. So how common is this kind of a picture actually? So we're not too bad by any means, but we're having this issue in the morning and issue during the day with being tired and so on. So what is sleep disordered breathing? So it covers several disorders actually, including obstructive sleep apnea or hypopnea syndrome, something you've probably heard of, obesity hypoventilation syndrome, COPD, so chronic obstructive pulmonary disease, and central sleep apneas. Most of the literature focuses on obstructive sleep apnea, but there's very common themes in the sense that these articles and literature highlight that there's a significant prevalence of obesity and sleep disorder breathing in the last 20 years. Approximately 7% of the adult population are affected by sleep disorder breathing, and nearly 1 million people are affected worldwide. How crazy is that? So these are very interesting facts. Feel free to read these articles, but there's an overarching theme here that lifestyle plays a huge role on it, and provided we sleep a lot of time of our lives, it's very important to get good rest and to highlight these things. So now let's move on and talk about why it actually happens. So apnea. Apnea means stopping breathing, and hypopnea means under breathing. So those are the two defined terms we can highlight here. There are two main causes of sleep apneas, central and obstructive. We're going to focus more on obstructive. Central causes result from inadequate kind of stimulation from the ventilatory control center in the brainstem, and then the signals are all messed up, and that can happen in issues with signaling. So with diseases such as Parkinson's disease, stroke, end-stage renal disease, heart failure, atrial fibrillation, and sedatives. So these things can impact and cause central apneas. Well, we're going to be focusing more on the obstructive side of things. So in the obstructive side of things, this implies that the airway, which is usually the pharynx, is partially or completely obstructed, and it obstructs airflow as highlighted in this picture. There's a lot of risk factors there. There are a lot of risk factors like we alluded to earlier on, so they can be obesity, increased waist to hip height ratio, the male gender, family history of it, Asian descent, narrow oropharyngeal airways, large tongues, recessed jaws. So there's a lot of risk factors there, and we need to be aware of them. And what about snoring? What role does snoring have? So snoring is linked to sleep disordered breathing and most commonly results from an airflow variation across portions of the upper airway, resulting in soft tissue vibration. So snoring doesn't actually necessarily result in an airflow disruption or oxygen desaturation. But when snoring is associated with these things, then that's trouble and we need to investigate why it's happening. So snoring isn't the end of the world, but when it's impacting desaturation and things like that, then we have to look into it. And what are the consequences of sleep disordered breathing? Well, sleep disordered breathing is associated with an increased risk of hypertension, atrial fibrillation, heart failure, chronic heart disease, stroke, and death. There can be economical impacts, so the workplace and traffic accidents can occur. You can have reduced concentration and productivity, and also it can impact the overall psychosocial profile, so the quality of life and the mental health, depression, and things like that. So let's go back to our gentleman from the start of the video, our 60-year-old. So we need to address if there is any snoring. we need to address if there's any witnessed apnea, so collateral history would be useful to evaluating the situation, questioning the individual as to how the sleep is. Was it refreshed sleep or unrefreshed sleep? Was there waking headache? Do we need a lot of alarms in the morning? Did we wake up in the night for any reason? Are we tired during the day? Is there any choking in sleep? Is there broken sleep? Is there memory concentration issues? So all these things impacting our sleep can point us in certain directions. And then, of course, we need to talk about the lifestyle, so the comorbidities, the family history, like we alluded to earlier on, and the psychosocial profile overall. On top of that, we need to do a physical examination. So height, weight, BMI, neck circumference, examining the jaw, do we have a recessed jaw, things like that, and also signs of comorbidities. And then we can do certain questionnaires, let's call them, to assess whether somebody is pointing in that direction of obstructive sleep apnea, for example. So a famous questionnaire or scale that can be used is the Epworth Sleepiness scale. We'll link that in the bottom in the comments section below. The Stop Bang questionnaire as well. So these are very, very useful tools. You can do them at home. You can do them with your doctor to assess and see, are we in that category of obstructive sleep apnea, and do we need to take this a little further and investigate it a little bit more? These are all things, by the way, that you can assess in your own home, in your own living room, with your partner, with your wife and husband, or whoever it is, and you can really evaluate yourself and how you are sleeping. And then what will actually happen when you go and see your doctor. So a lot of similar things. So all these things we mentioned, a full-on kind of questionnaire and physical examination and things like that, the doctor will do all of that with you. And then at that point, we're going to have to make a decision as to, do we need to investigate this a little bit further? And generally, the first line of investigation is going to be a blood test. A blood test to see if there's anything organically going on, to see if there's any comorbidities, to see if there's anything else happening. And the main thing to be looking out for here is diabetes. Is there any PCOS, polycystic ovarian syndrome going on, thyroid disease, cholesterol, so lipid profile, and heart failure signs. So these are the things that your primary care physician is going to be looking into. And then if we need to, we're going to be referring on to secondary care. So to sleep clinics, to sleep studies, to do more robust investigations, such as simple sleep studies that can be done. A simple sleep study involves wearing an oxygen probe on one of your fingers during sleep, and it can be done overnight at home. So typically the person collects a simple monitor from a hospital and then you return it the next day. You can do a respiratory polygraphy. So if a simple sleep study doesn't kind of give you the useful information you need, then you can do a polygraphy at home. So this involves wearing a small portable monitor that measures the nasal airflow going in and out, and then you get some information out of that. You can do inpatient sleep studies. So that is can be arranged if things are inconclusive. You do that in the actual clinic, and you can observe your vital signs, you can observe how your brain activity is working, and things like that. So very useful things that you can do in secondary care as well if things are proving inconclusive. What can you do at home though? So these are things you can do at the sleep clinic, but what can you do at home? So sleep hygiene obviously is the most important thing. I've been banging on about it the whole video. So lifestyle plays a huge role. So sleep hygiene describes behaviors that promote healthy sleep. So when we're talking about your bedroom, we are talking about light exposure. So particularly to screens, that should be minimized. Your room should be dark, quiet, and cool. So that's very important. You should have an allocated time for sleeping. Your bedroom should just be for sleeping, not for chilling on your laptop or whatever. You should have consistent sleep and wake times. When we're talking about other things such as food, so meals should be consumed 2 to 3 hours prior to bedtime to reduce the possibility of acid reflux. Caffeine consumption should be avoided a few hours before bedtime as well. In addition to exercise as well, many people don't think about this, but you should probably avoid it 2 to 3 hours prior to bedtime as well. People should be counseled to reduce their consumption of alcohol to a maximum of 14 units a week, and also avoid alcohol before bed. Another thing you should do is to stop smoking. So nicotine is a stimulant, so that should ideally not be consumed either. All people who smoke should benefit from kind of going to smoking cessation services that are available throughout the country that you are in, hopefully. Addressing these factors can improve people's kind of obstructive sleep apnea symptoms, but if they don't work, again, you can go through the sleep clinics and through secondary care, and you can get things like a CPAP machine, you can get supplemental oxygen. So CPAP machine is the most kind of famous or most kind of well-known support. So that helps maintain a patent airway with continuous airflow, splinting the airway open during respiration, during breathing. And then also you can have surgery and things like that, right? To remove big tonsils, for example, and things like that. Another important thing to highlight here is that if you're awaiting these sleep studies and you're having a lot of tiredness during the day, try and avoid driving, right? Minimize that risk, please. So there you have it. That was a quick video on sleep disordered breathing. It's a very important topic. As we said in those two articles, I highly recommend giving them a read, finding them on Google. Key points. So sleep disordered breathing, common. It affects 7% of the UK population, probably similar in other nations. Sleep disordered breathing can be divided into central and obstructive. Obstructive is the 90% we were talking about here. Untreated sleep disordered breathing, well, that's the video. Leave a comment in the section below, like and subscribe for more, and we'll see you in the next video. Take care.